Hello everyone, my name is Dr. Ungku Fatimah. In this video presentation, I would like to share a research findings from a work conducted with my fellow team from the University Putra Malaysia and the Ministry of Health. The research entitled Knowledge, Attitude and Practice on the Preparation of Healthy Meals Among Food Operators in Selected Areas Around KLANG Valley. This research was funded by the Nutrition Division, Ministry of Health. As an introduction, according to the World Health Organization, healthy eating has been one of the ways to prevent diseases such as heart disease, stroke, type 2 diabetes, and certain forms of cancer, especially those linked to non-communicable diseases. In Malaysia, according to the Ministry of Health, one of the country's major causes of non-communicable diseases was due to unhealthy eating. Cases of diabetes could be due to easy access to food, especially among the young people. Research have shown that the lack of healthy food choices provided by food operators while eating away from home can contribute to poor eating lifestyles. Clark et al. Reported, as the fast food industry grows rapidly, it is difficult to consume healthy food when dining out because most foods serve high in sodium and saturated fat. To encourage healthy eating, developed countries are paying more attention to the importance of nutrient labeling to assist customers selecting healthy choices. Studies have shown that consumers make healthy decisions if supplied with nutrient data and will more likely to select items with fewer calories. However, in Malaysia, Dean et al. Reported that most restaurant owners and staff still have insufficient knowledge, understanding, and awareness of nutritional labeling. While other studies have explored healthy cafeteria as another intervention to healthy eating, nonetheless, this intervention requires having the right understanding, knowledge, practices, and a variety of ways to encourage healthy eating among the restaurant practitioners. Further studies have identified several challenges to offer healthy meals in restaurants and found consumer demand and cost of ingredients are the most influential factors. In Malaysia, although the restaurant industry is still behind in providing nutritional labeling, the Ministry of Health has introduced several interventions to encourage healthy lifestyle, where food operators play a role in preparing healthy meals for consumers. These include Malaysia Healthy Plate and Malaysia Healthy Catering Training. Educate knowledge among food operators and costs of implementing healthy menu are the most important factors affecting healthy meal incorporation. But to date, little is known about the level of knowledge, attitude, and practices in providing healthy menu among food operators in Malaysia. Therefore, this study aimed to assess the level of knowledge, attitude, and practice on the preparation of healthy meal among food operators in selected areas around KLANG Valley, and to compare the level of knowledge, attitude, and practices based on types of operation, and finally to determine food operators' perceptions toward the preparation of healthy meal. The sample of the study is food operators involving in food production, including the chef, cook, and owners. Convenience sampling technique was used to select sample located in the KLANG Valley. Data collection was done using self-administered questionnaire and online survey. Questionnaire was pre-tested prior to data collection, and for data analysis, descriptive analysis and mean comparison were used. The survey questionnaire consists of 4 sections. The first part is knowledge. Multiple choice question was used, and the questions were developed based on the Ministry of Health training content covering the scope of fiber, sugar, salt, fats and oil, and nutrient in general. Next, question on attitude and practices. Each was measured using a Likert scale and 10 items were used to measure. The final part is demographic and several measures on perceptions towards healthy meal preparation. This slide shows the demographic profile of respondents. A total of 200 respondents were surveyed, half of them aged between 18 and 29 years old, slightly more female than male, about half are owner and supervisory position, and majority are Malay. There are 4 types of operations surveyed. These are restaurant, street food, cafeteria, and catering and canteen. Most operations surveyed serve local food, followed by 30% Western food and about 15% Thai food. This survey result is the level of knowledge on preparing healthy meal, specifically the top 5 correct answers. Majority of respondents had answered correctly on question about fiber intake and sugar intake, which is more than 90%. On the other hand, less than 50% of respondents had correctly answered question on fat intake. Next, this slide shows the top 5 rating on respondents' attitude. The highest main rating was on the need to have knowledge of healthy meal and how to prepare it. Following that were attitudes toward nutrient and oil usage. This slide showed the lowest rating attitudes, which were rating on salt intake, use of coconut milk, and sugar intake. In terms of practices, respondents rated the highest on similar aspects as attitude, which are related to nutrient and oil usage. And same goes with the lowest rating of practices, which are pertaining to coconut milk and sugar intake. Mean comparison analysis was conducted to compare the level of knowledge, attitude, and practices based on the type of food operation. The comparison was made between restaurant, cafeteria, catering and canteen, and the street food. For knowledge, the score was transformed into percentage. Overall, the score was less than 80%, which indicate a moderate level, and there is a significant difference between the type of operation. While for attitude, all the rating was above 4 out of 5, suggesting good level of attitude. But there is no significant difference between operation. Finally, the level of practices is considered moderate, in which mostly are below 4 out of 5. And there's also no significant difference between operation. Overall, the result shows respondent from restaurant has the lowest knowledge compared to other types of operation. In Objective 3, we asked respondents about factors that influence them for preparing healthy meal. The result shows customer demand was the most important factor, in which 170 out of 200 respondents select this factor. Next, employee knowledge and employee skill were important influential factors. Therefore, this result indicate food operators are more likely to offer healthy meal if employees have the knowledge and skills other than enhancing customer demand. Then we also check the number of respondents who have attended healthy catering training. a voluntary training provided by the Ministry of Health. Almost half of them have attended the training, but 95% agree this special training initiative on preparation of healthy food should be provided to food handlers. We further asked respondents about the training options. In terms of duration, majority agree it should be between 1 and 2 hours. In terms of delivery, respondents equally state online and practical delivery method should be used. Many respondents select the chef and cook should be the potential attendees for the healthy catering training, and most of them suggest the training should be made compulsory. Finally, we asked respondents about the training fee, and half of them suggest it should be combined with the food safety training as provided by the food handlers. In conclusion, this study found food operators have moderate level of knowledge with best understanding on fiber but low information on fat. The level of attitude and practices among food operators regarding sugar are the lowest compared to other nutrition concerns. Majority of food operators in the study agreed a special training initiative on the preparation of healthy food should be provided to them, and this need can be further supported by the moderate level of practices. Overall, this study provides the baseline data in designing an effective training that will strengthen food operators' knowledge, attitude, and practice in the preparation of healthy meal. For recommendation, the study suggests the Ministry of Health need to provide technical knowledge to prepare healthy meal, since employee skills and practical training mode were regarded as important by the respondents. The training should also cover the technical aspects such as procurement, costing, budgeting, and resources. All technical knowledge can be delivered during training or made available on the Ministry of Health website for reference. Ministry of Health can also recommend the universities offering culinary, hospitality, and food service program to ensure their students attend the healthy catering training during the course of studying. It is also recommended that the content of the healthy catering training focus on motivating the industry to offer healthy meal, not only just creating awareness as in the current training model. This can be done by highlighting the benefit and opportunity, such as marketing and financial implication. So these are the references used in this study. That's all for the presentation, and thank you for listening.